Since the outbreak of Newcastle disease, the United States has become a global disaster area. According to data, the cumulative number of new deaths in the United States has exceeded 300,000, and the cumulative number of confirmed cases has exceeded 17 million. Faced with the big test of the epidemic, the US government's answer can be described as chicken feathers in one place. In the face of the rising death toll, the myth of liberal democracy and the establishment of human rights defenders continue to crumble. Since the outbreak of the epidemic, the federal government and local governments in the United States have been constrained by each other. Contradictions and conflicts continue to expose serious problems in the governance system. Leslie Saxon, a professor at the Keck School of Medicine of the University of Southern California, believes that American society is plagued by highly politicized and chaotic coping styles. Scott Gottlieb, the former head of the Food and Drug Administration, warned in an interview that the number of infections in the United States will continue to rise, possibly reaching a new peak in January, and the pressure on the medical system will reach a peak later. Recently, although the vaccine has come, the epidemic situation in the United States is still unresolved in the short term. New York Governor Andrew Cuomo said the vaccine was like light at the end of the tunnel, but it's a long tunnel. Fauci stressed that the start of vaccine distribution does not mean that Americans can relax routine public health measures. Vaccines are not a substitute for public health measures, including wearing masks, maintaining social distance and avoiding gatherings, especially indoor meetings. Stanley Perlman, a professor of microbiology and immunology at the University of Iowa, said that if there is a lax attitude towards the epidemic indicators may continue to deteriorate. Bill Gates, co-chairman of the Gates Foundation, said that although the United States has authorized emergency use of vaccines and will begin to vaccinate this week, the United States is far from out of the woods, and the next 4 to 6 months are expected to be the worst phase of the new crown pneumonia epidemic in the United States. The U.S. government must learn from the epidemic and allow professional agencies and experts to release relevant information and recommendations in a timely manner, rather than trying to cover up and repeatedly downplay the epidemic. The weak anti-epidemic response of the United States is only the result, which is rooted in the long-term accumulation of drawbacks and contradictions in the political, economic and social levels. In the face of the epidemic, if the people in power in the United States cannot face up to the reality and really take the lives and well-being of their own people into account, I am afraid that the new crown of the war will continue, and the injury of the United States is not yet exhausted.